Conversation.
What's the problem?
I think there is something wrong with me. I bleed when I have a bowel movement. I'm afraid I'm having hemorrhoids.
How long has it been?
3 days.
Have you been constipated lately?
No, I'm normal, I think.
Do you have pain when you have a bowel movement?
Sometimes.
I'll give you some medicine. If you feel it's not better, please come again.
Do I need surgery?
We will talk about that again if your conditions are not better.
Okay.
Don't sit for a long time and keep your anus clean. And don't carry or lift heavy things.
Thank you very much, Doctor. I feel like I have a cold.
What symptoms do you have?
I have a cough, a throbbing headache, a sore throat, and the chills.
Have you vomited?
Yes, I vomited this morning.
And do you have a runny nose?
Yes, and my nose is blocked.
Please sit here. I will take your temperature. It is 39 degrees centigrade. You have a fever too. And let me check your throat. Open your mouth, please. Do you have trouble when you swallow?
Yes, it's quite hard to talk and swallow.
Do you cough up phlegm?
Yes, I do.
Your throat is swollen and inflamed. You should not drink cold water or alcohol. I'll prescribe some medicine for 4 days. Please rest and stay in bed today.
How long will it take to recover?
About 4 or 5 days.
I see. Thank you very much. Conversation.
Please take a seat. What's the problem?
I have had a cold for 2 weeks. I came here and a doctor prescribed some medicine for me, but I didn't feel any better.
Do you have a fever?
Yes, I do.
How long have you had a runny nose?
2 weeks.
Okay. I'll take your temperature.
Okay.
Your temperature is 39 degrees centigrade. It's quite high. Do you have difficulty breathing?
Yes, I wheeze sometimes, and my chest hurts as well, especially when I cough.
You should stay in the hospital.
Oh, that's very terrible.
Don't worry. Please stay in bed and relax. I'll come to check again.
I feel easily tired when I do anything. I don't have an appetite, I perspire, and I have a slight fever in the night while I'm sleeping.
When did you have your last checkup?
A few years ago. I rarely have checkups.
Okay. Have you ever coughed up rusty phlegm?
Yes, I have.
Have you ever had this problem before?
No. What's wrong with me?
I can't tell you now. Let's take an X-ray and thorough physical examination. When I have the results of the X-ray and examination, I'll tell you.
Okay.
You have pulmonary tuberculosis.
Oh? Is it serious? Is it possible to recover, doctor?
Please take it easy. You will get well soon if you follow my suggestions.
Yes. What should I do?
I'll give you some medicine, but if there are any side effects, please come again. You have to take care of yourself much more. One more thing, you should not smoke.
I see. How long will it take to recover?
About 6 months.
And do I have to come to the hospital regularly?
It's not necessary. You have to come just for periodic checkups.
Is the disease contagious? I'm afraid my family will catch it.
You have to keep your personal belongings separate, such as a towel and a glass. Anyway, you have to come to the hospital immediately for a consultation when you feel bad.
Okay. Thank you very much,
Conversation.
Doctor.
What's wrong?
I thought I had a cold, but I have had a fever for several days.
What symptoms do you have?
I can't stop coughing, and I have a lot of phlegm.
How long have you had the cough?
About 3 weeks.
What color is the phlegm?
It is purulent.
Do you smoke?
Yes.
You must stop and give up smoking so that the bronchus heals faster and doesn't get worse. Besides, smoking is not good for your health.
I will try.
I will give you some medicine. You have to take a rest for at least 3 days.
Okay. Thank you very much.
Conversation.
I have been coughing for a long time.
Do you have phlegm?
Yes. When I cough, I get a lot of phlegm in my throat. It causes difficulty in breathing.
How long have you had this problem?
For 2 months.
Do you smoke?
I have given up smoking for a long time.
Okay. Do you have a fever too?
Not at all.
Do you use any expectorant?
Yes. I have used it for a month.
Does it help?
A little bit.
I think you should stop using it. I will prescribe something else for you.
Thank you,
Conversation.
Doctor. I have terrible heartburn.
When did you start having this problem?
In the morning, after I had breakfast.
What did you have for breakfast?
I had papaya salad, red curry, and spicy sour soup with shrimp.
And what did you drink?
A bottle of soda pop.
Do you feel nauseous as well?
Yes, and my abdomen feels as if it were tightly squeezed.
I'll give you some medicine. If you don't feel better in a few days, please come again.
Okay.
You should not eat spicy food or drink anything too hot or too cold. And you should eat soft food, such as gruel, until the pain goes away.
I see. I'll do as
Conversation.
you say.
What's the problem?
I have a terrible stomach ache after having breakfast.
How long have you had the problem?
About an hour, but I feel the pain is worse when my stomach is empty.
Does it always hurt when your stomach is empty?
Yes, and when I drink coffee, it hurts.
Okay, I'll give you some medicine. You should not drink hot things or alcoholic beverages. Try to avoid spicy food as well. If you don't feel better in 1 or 2 days, please come back for further investigation.
Thank you very much. Doctor, I have a terrible stomach ache.
Where does it hurt?
Somewhere around my belly button, and sometimes it hurts on the right.
When did it start to hurt?
This morning.
How does it feel when I press on the right side of your abdomen?
It hurts very much.
Are you constipated or do you have a fever as well?
Not at all.
Let's take CT scans to see if you have appendicitis.
Okay.
According to the results of the CT scan, you definitely have appendicitis, so you have to have surgery. You should not eat anything before the surgery.
I'm so stressed about the surgery.
Please take it easy. It's not as bad as you think. You will recover after the surgery.
I don't know why I feel nauseous after eating, and I have had terrible diarrhea for 3 days.
Did you vomit?
Yes,
Do you have a temperature?
just a little bit.
Do you remember what you had eaten before you had the problem?
I had a party with my friends 3 days ago, and we ate many kinds of food.
Did your friends get this problem like you?
No, it was only me.
Okay. And have you been taking any antibiotics?
No, I haven't.
Okay. You had better not eat anything today, apart from electrolyte replacement, until you feel better. Then you can have some liquid food.
Okay, thank you very much.